Again, welcome to our Tuesday morning edition. City of Kamloops and BC, for that matter, have all been enduring a doctor shortage, leaving those without a family doctor to make greater use of walk-in clinics. But they, too, are becoming in short supply. Just two clinics left in Kamloops. To talk about this and other medical matters, we're pleased to welcome back to the program the president of the BC Medical Association, Dr. William Cunningham. Good morning.
Good morning.
Now, from your perspective, what is the situation with walk-in clinics in the province general? Are there enough of them? Are people becoming too reliant on these things?
Well, I think people are becoming too reliant on these things, and we really encourage patients, individuals, to have a family doctor that can give them what we call longitudinal care, that they're there for all of the problems, including those urgent problems that patients go to the walk-in clinics for. Mm-hmm. Ideally, the family doctor should be able to accommodate them just phone in, and hopefully the family doctor can see them. And the BC government and the BCMA have done a whole slew of things to give better access to family doctors, and specifically in Kamloops, the Division of Family Practice has some specific initiatives that increase access to family doctors as well.
What are some of those solutions that you're talking about, with the divisions of family practice? Because my understanding is that there are still thousands of people without a family doctor who just can't get to see a family doctor because there's no room.
Well, let me actually do it the other way around, perhaps, and go over what's happened provincially, and then we'll hone in on what's happened with the excellent family practice division in Kamloops. So provincially, between the BC Medical Association and government, they've invested in all kinds of things. And the first one is something called a GP for Me, which provides for much more efficient types of practices. So there are a lot of the chronic disease problems or renewals of medications can be done over the telephone. So you don't have to go in because that's more time consuming. And the family doctor can actually do that over the telephone. In White Rock in Surrey, the local division there, they actually had a little clinic which was totally dedicated to attaching patients to a family doctor. There are training modules we've had for office management processes where we encourage doctors not to book fully and to leave lots of slots open for those urgent cases that are currently going to the walk-in clinics. I think a lot of people think if they've got a really sore throat or earache, the walk-in clinic's the place to go. Well, that's not really the case. They could see their family doctor if the slots were left open to fit in those types of patients. There are lots of recruitment and retention programs. And then the next thing that we're going to work on a bit are those multidisciplinary clinics, where it's a bit more of a team approach with physician extenders, physician assistants, or nurse practitioners.
That's the provincial picture. What's happening in reality in Kamloops? Because I haven't had many people tell me they could just phone a doctor and get some advice over the phone. They generally have to come into the office.
Yeah, so these are relatively new programs, and they were just negotiated in the last 6 months. So certainly we have to make all of our members aware of them and how to bill for them appropriately. So in Kamloops, you've got a Division of Family Practice, which is the organization of the family doctors in the community, and they deal with the local problems. And you'll see right across the province, these divisions in most every community have done amazing work. So in Kamloops, what they've done, they have established a recruitment website highlighting the benefits of living and working there. They participate in both the regional and then also the provincial recruitment working groups. And one of the most important things that's very exciting is they're launching a family medicine residency program in January 2014. So I work in the Cowichan Valley. Actually, I'm an emerge doctor. But we've had a residency program there, and the residents that go through the program are then much more likely to stay, in our case, in the Cowichan Valley. Mm-hmm. And in your case, they will hopefully stay in the Kamloops area afterwards.
Dr. Cunningham, these new programs that you're speaking of, has there been good buy-in by family physicians?
There's been excellent buy-in. The morale of the family physicians is much better where there's a good division, and there has been excellent buy-in. Certainly in the original ones, the prototype sites that are a little bit older, there's been excellent buy-in. I can tell you, in the community where I work, the most established practices, the ones who actually leave open spaces for their own patients, those patients are just not seen in emergency departments. And then the other good thing about it is with a lot of the chronic disease management things, we just do not see those chronic diseases in the emergency department any longer. So I can tell you that once these divisions get established, once these other things are adopted, the need for this acute kind of care or urgent care goes down, and the family doctors have a greater capacity to see the patients and can actually expand their practices.
So when do you advise people to actually use a walk-in clinic? It sounds like you'd rather steer them all to family doctors.
I'd rather we never had walk-in clinics in the first place. However, they are necessary now because we've become dependent on them. But I think with the much greater popularity of family practice as a career for physicians now, for the young physicians coming out, and the way they do practice and the way we've thought out how they can practice more efficiently, the need for a walk-in clinic should decrease over time. We would much, much prefer if, as I say, the family physician, the first point of contact for anything that's urgent were in fact the family doctor.
Do you see a problem?
They know it works.
Mm-hmm. Do you see a problem with the compensation formula for doctors who work in walk-in clinics? I gather the first 55 patients of the day, they receive full payment. The next 10, half payments, and anything above 66, they get no payments at all. Is that a financial disincentive to see more patients in a single day, or is that good?
Well, I think it is. I think it is good. You have to remember it was introduced in the mid-90s to discourage people from just churning the patients through, giving them a quick prescription of an antibiotic if they need it or not, and get them out the door. If you actually spend 10 minutes with a patient and you see your 50 patients, that's an 8.5 hour day, and that's quite enough. So it was introduced for quality reasons, and we do not want people to work at a much faster pace. I think patients and the quality of care they receive is extremely important. So if you in fact took off that cap, all that would happen is you churn through more and the quality would go down.
We're running out of time, and I did want to touch on this. The master agreement has a reopener in March, I gather. Speaking with the health minister earlier today, Terry Lake was suggesting that the BC Medical Association and its members need to be painfully aware of the government's fiscal situation. Sounds as if he's saying there's not much room for a financial lift. Is that disturbing to you?
That would be a topic in its own right for another discussion with you at some other time. The BCMA is very well aware of the financial constraints of government, and we can work with government in negotiations. This is the physician master agreement actually reopeners in 3 years, and this just reopens a small component of it.
Okay, so this is not a big deal. It's not a huge impediment for you?
It's not a huge impediment. I think the thing to do is to sit down, focus on the needs of patients and the quality of care that you can give to patients, and that's what we'll be doing with government.
One quick final question. There's a petition in Kamloops that's growing opposing paid parking at the emergency department at the Royal Inland. I gather the BCMA has a policy on paid hospital parking, or at least a viewpoint.
Well, I had an interview in that the other day, and we actually discourage it. It is a way for health authorities to raise money. Again, where I work, there is no paid parking, and that's a great thing. Paid parking discourages people from visiting, discourages people from going to hospital. It's just another irritation in the healthcare system, and quite frankly, it's really a user fee.
I think a tax on the sick is how you paraphrased it.
I think it is a tax on the sick. I don't believe it's a very good thing to be doing.
Dr. William Cunningham, president of the BC Medical Association. Let's talk another day. Thank you very much for speaking with us this morning.
My pleasure.
Elizabeth Duckworth winds up her work at the Kamloops Museum and Archives later this month. She's next when the Jim Harrison Show returns.